Taking psychiatric medication does not mean you are weak or failing. Mental health conditions physically affect the brain, nervous system, and sleep. Medication is a valid biological support tool used to stabilize these systems. You do not have to choose strictly between an all-natural path or an exclusively medical one. The most effective route for many is a coordinated care plan that balances medication to support the body, therapy to build skills, and personal responsibility to guide the process. This split-screen chart illustrates how severe symptoms, like panic attacks or profound insomnia, leave patients without the physical energy to engage in therapy. Medication lowers the volume on those intense biological responses, creating the stability and mental capacity required for therapy strategies to take hold. This process involves practical trade-offs. Medication provides targeted symptom relief and lowers the risk of relapse, but it requires navigating a trial and error period to find the right dosage and manage side effects. Because of how these medications interact with your brain chemistry, you must never stop taking them suddenly to avoid side effects. Doing so risks severe withdrawal, rebound symptoms, and immediate relapse. Always consult your doctor for a safe tapering plan. It is common for patients to want gentler, natural options, turning to traditional Chinese medicine or dietary supplements to manage sleep and stress. However, this diagram shows the risk. Natural does not mean harmless. Botanical supplements are chemically active and can cause dangerous interactions when mixed with psychiatric prescriptions. Integrating TCM or supplements requires a structured, transparent conversation with your psychiatrist, ensuring your care is safely coordinated. Keeping natural remedies a secret from your medical team does not protect your independence. It creates blind spots that actively compromise your safety. As an outpatient in Singapore, you have specific rights in your psychiatric care. You are allowed to request medication reviews, ask your doctor for treatment alternatives, and seek a second opinion. To make your psychiatrist a true ally, bring specific data to your appointments. Track your exact medication dose, any missed days, and document specific patterns in your sleep and mood, rather than describing general feelings. Your care relies on an entire ecosystem. Therapists target behavior change, pharmacists clarify medication instructions and side effects, and caregivers help track external patterns while respecting your dignity. When you give consent for your psychiatrist, therapist, and caregivers to communicate with each other, you eliminate the information gaps that lead to poor treatment outcomes. Personal responsibility in mental health means being honest with your providers, tracking your symptoms accurately, and participating actively in care decisions. Take the next step in your recovery. Visit flockcare.com.sg/insights